Okay, Neuralink is a company that's headed by Elon Musk, but what are they working on and what is Neuralink anyway? Simply put, Neuralink is essentially an implant that goes on the brain or spinal cord of a patient that is meant to restore functionality that was otherwise lost. This is actually something that was talked about rather extensively the other day, as there was a presentation and kind of a showcase of what the capabilities are of this implant. But other than that, what can it really do? As of right now, Neuralink is a way to interface with technology using just your brain. Most of the time right now, we usually interface with technology using something like a mouse and keyboard or maybe our thumbs. So essentially the brain implant takes brain signaling and moves it to a computer in a way that can be translated into something like moving a cursor or selecting something on a screen. So is this meant to create a whole society of cyborgs? Well, I don't really think so, at least not yet. Okay, brief intermission. If you're as excited about Neuralink as I am, make sure to leave a like so that this video could maybe be shown to somebody who doesn't know about Neuralink. As well, there are going to be chapters for this video talking about some of the broader topics. Given that this is going to be kind of a long one, you can skip to wherever it is that you want to go or what you want to know about. Also, given that the presentation was something like 2.5 hours long, I'm trying the best I can to cover all the major topics, but there's going to be a lot of stuff that I missed. So if there's anything that you're still curious about or you think I should have mentioned, make sure to leave a comment and let me know, or go and check out the full presentation, which I'll link in the description. Alright, back to the video. Right now, Neuralink is being developed as a clinical solution for those that may not have the motor inputs in order to control different kinds of technology. For example, somebody who's not able to control their hands may have a harder time interfacing with different technology like tapping on a screen or using a mouse and keyboard. There are other ways to provide accessibility to these users, but sometimes these methods of input don't match the same data input rate as something like a mouse and keyboard. So for somebody that's not able to control their hands or maybe their arms at this point, using just the signals from their brain in order to interface with technology would make a huge difference. You would go from having limited use of devices, or maybe in some cases not any at all, to being able to interact with devices at the same way somebody else would. And in terms of who this is for, this kind of expands broadly depending on the development of the hardware. Right now it's still really in the development phase and hasn't exactly reached the level of being a full-on product yet. In the presentation, it was showed that this can go even beyond just you interfacing with a device, and there's the potential for it to go the other way as well. There's the potential to bring images to somebody who's never been able to see. And this visual impairment could be the result of disease that results in non-functioning eyes. The reason why this is still possible is that the part of the brain, the cortex, that's associated with your vision is actually still present. There just aren't eyes that are able to give the visual input in order to process images. So with Neuralink able to do the processing from something like a camera, then you could start to have those images input via signals from the implant. So why is this important? Well, if everything goes to plan, this is essentially cutting-edge research in neurophysiology. Solutions to diseases with the eyes, or maybe in some cases even motor function, is something that we've been struggling to solve for a long time. Having a device that's able to transmit these brain signals across other devices and do it the other way around is something that could be game-changing. Having the implant be able to stimulate muscle contraction is something that could be a huge problem solver for people who have spinal cord injuries. Given that the pig's muscle contractions and extensions in the leg have been tracked in the past, they were able to replicate those same signals that came from the pig moving their leg and output it using the implant. So for example, there's somebody who has an injury to their spinal cord. So if Neuralink is acting as the signaling device that can bypass the injured part of the spinal cord, then these signals that used to come from the brain can now go over that section and stimulate the muscles. And even just talking about things like restoration of muscle movement, vision, or being able to interface with electronics using your brain just sounds like science fiction. So I think this is important because this seems like something that could be driving medical implants or research for possibly the rest of the future. So are you able to go out and get your Neuralink implant today? Not quite yet. As of right now, Neuralink is still waiting on approval from the FDA, and they're anticipating that the first human trial is going to come within the next 6 months. Right now, there's only really been 2 types of testing. It started off with bench testing and then progressed into animal testing. Originally, the bench testing was done using synthetic brains that were supposed to mimic human brains or brains that the Neuralink implant could be used for. In the animal testing, the monkeys have proven that interfacing with technology using the implant is pretty seamless and actually works really well. The part where some people are saying there might be issues is where certain signals that used to be corresponded with a movement like raising your right arm might be confused or once changed over time implant may not correspond to that movement anymore. So how do you get this implant put in anyway? It's actually done during a surgical procedure, and it's actually pretty interesting. During the showcase, they actually showed the robot that they've developed to do this procedure. Well, at least part of it. Right now, the procedure really consists of 6 steps, and one of which is able to be done by the robot. This step is implanting the leads that go from the implant into the brain. The fact that the robot is able to do this is pretty amazing given the scale of this being very, very small. I believe in the presentation they said that the leads or threads that come off of the implant are something like 3 blood cells wide, which is kind of insane. So essentially the robot uses a camera, looks at the brain, and sees where the leads are supposed to be. There's given markers on the brain where these leads are supposed to be coordinated with certain sections of the brain. And the robot is supposed to see where the blood vessels are, because if you puncture the blood vessel, you're kind of in bad shape. But it seems as of right now, the machine is able to detect the blood vessels and know not to insert a lead there. And in the presentation, they talked a lot about how they want this product to be accessible to a lot of people. So after the implant is put in, the skin goes back over it. So in theory, it takes up the same amount of space as the skull that was removed in order to put the implant in there. Once your skin goes over, there's not really supposed to be like a bump or anything, so it seems like nobody should really know that you have the Neuralink implant at all. They talked about durability in the presentation, and they said that as of right now, after about 1.5 years of use with their longest standing implant, there hasn't really been any problems. The only reason they stopped using it after 1.5 years is because they upgraded it to the newer version. The part where I have a concern about this is that the implant being where the skull used to be means that there's some section of the skull that is now missing. Given that your skull is really supposed to be this protective shell for your brain, I kind of wonder if there's some trauma or impact to that area, how dangerous that could be, but I'm assuming that's something that'll be addressed in the future. This point wouldn't be massive by any means. As of right now, the implant is supposed to be about the size of a quarter, but still, if something hits in that area and there's no skull, I don't know if it just like pushes right on the brain or how that exactly works. As of right now, the implant needs to be upgradable. That's something that Elon talked about, saying that the first version of the Neuralink implant is similar to having a first generation iPhone placed in your head. Given that technology moves so fast, it's really critical that this is very easily upgradable. Right now, the idea is that the threads that go in the brain are so small that there shouldn't be issues taking them out, or there shouldn't be a major amount of scar tissue that forms, and it should be as easy as just taking the old one out and putting the new one in using the same space that's given. One of the things that accentuates just how important this is that the second version of Neuralink right now uses a fraction of the power that the first version used. So getting these upgrades over time is going to be essential to somebody who needs to be able to keep up with the latest technology, and you don't want to be stuck with the first generation iPhone in your head when people are moved on way past that. So as with any version of technology, you're probably wondering how this charges. You probably don't want to clip a charger to your head right before you're about to go to bed, and you might be wondering how it doesn't get too hot. As of right now, it seems that the charger for Neuralink is going to be wireless in the sense that you just need to be like pretty close to it. The example that they gave in the presentation is that there's a monkey that when he goes up to drink his banana smoothie, the charger is in a branch above his head and it charges while he's eating his breakfast or something. And they know that this needs to charge pretty quickly because somebody doesn't want to sit in one area to charge their implant before they need to go. So I'm wondering where exactly these would be placed. It would probably have to be somewhere in your house, similar to how the monkey was doing it, where you might be doing something anyway and have the thing charge while you're doing some other task. But it's hard to say exactly how this would be implemented given that it's so early in the process. So what do I think the future looks like for this device? I think it's going to go way beyond just the signaling for moving a cursor around. And in the presentation, they talked about how they can translate writing signals or thinking about writing signals in the brain into letters, but I think it'll go even beyond that. Right now, the fastest version of communication that we have seems to be speech. So me talking to you right now is going to be a lot faster than me writing it out with a pen and paper and then showing it to you. Unless you're like a speed reader or something, in which case I'm simply not talking fast enough, but I think you could play it on 2x speed. But in the same way that dictation can be faster than typing with your thumbs on your phone, I think that speech signals signaling, once it's accessed, will be able to speed up the level of output drastically versus the thought of writing different letters and things like that. In which case, I think that the level of output with the Neuralink would far exceed somebody typing on something like a keyboard. So they actually did a Q&A session as well after the presentation, and here's some of the things that I found to be kind of interesting. During the presentation, somebody asked about what some of the other implications would be with using Neuralink that maybe they hadn't mentioned yet or somebody hasn't thought of. One thing that Elon mentioned with this device being implanted in your brain, it actually has access to a lot of health metrics that go beyond just something like a smartwatch. So being able to monitor your heart rate from outside your body is possible. Being able to monitor things like body temperature within the body, Elon is saying that the implant detecting these changes to being abnormal might be able to detect a fever very early on, in which case that would be really cool and really helpful. So being able to have this thing as like a super health monitoring device would be insanely helpful for the healthcare field. Another thing somebody asked was just about how long would this implant last. Right now they say that the actual enclosure should be able to last up to 20 years. They know this because they do stress testing that simulates that amount of time, but obviously it's a little bit different in an actual person. As for the battery and some of the components inside, they say that the estimation for time that this would need to be replaced at is about 3 years. Over time, I'm thinking that this will be a little bit longer, but given that batteries, especially at that scale, degrade over time, the 3-year mark is probably going to come around kind of soon for people, so hopefully that process of exchanging the implant gets to be pretty easy. Somebody asked if they've considered other radio technologies besides just Bluetooth. Right now, the wireless connectivity from the Neuralink to other devices is meant to be using Bluetooth. They have been considering other radios since Bluetooth really has a cap for how much data it can transmit, but right now they're saying the main focus is to work on compression, which is decreasing the amount of data that's sitting back and forth and having it be unpacked at its destination. This is so that large amounts of raw data don't have to be sent across Bluetooth because it really can't do all of that back and forth. So we'll have to see which other radios they end up using in the future. One of the questions that I thought was actually a really good one was somebody asking how the implant would adapt to somebody's brain changing over time, like learning new tasks and skills that the implant might not know how to sense already. I'm thinking that just as the person learns, the algorithm they put in is going to try to learn with the person, so we'll see just how well that works. One of the things that somebody mentioned is that over time, if the implant wants to have access to more sections of the brain in order to do more things, they're going to need to put leads deeper down instead of just the surface, which makes sense. The problem with this comes that when you go deeper through the brain, there's more and more vessels that go over that area. Having to go in and then change direction with a needle, especially at that small of scale, is pretty tricky. So they're saying that one, they want to see that the needles get small enough to where it really doesn't matter if it goes through a blood vessel. Not really sure how small that would need to be, but I'm guessing incredibly small. Another thing they were saying is that taking the dura on and off, which is that section that goes over the brain, it's between the hard skull and the squishy brain. They're saying that eventually they want to be able to put the leads through the dura instead of having to remove it, which would cut out a step of the surgical process. Another good question that somebody asked is, what are the things that the FDA has concerns with? Right now, they're still awaiting the FDA approval with the use of the implant on people, and these are some of the things that they talked about. The FDA did say that there needs to be some confirmation that this removal of the implant works every single time. It's been pretty obvious that the implementation of the implant works really well, but they want to know that taking it out doesn't leave any lasting damages to a person. Another thing that you've thought about and they've thought about too is with regard to the charging and usage of the device. It can't get too hot. You can't have this really hot metal device sitting on top of your brain. So the Neuralink team is really aiming to have this be as safe as possible when charging and with constant usage, that it doesn't get too hot and stays below a certain temperature threshold. One of the things that they were saying is that this shouldn't change more than a couple degrees Celsius over time. One of the things that I think can be kind of challenging about this is that devices, when exposed to high levels of heat, like from sunlight or something like that, can have a really hard time staying cool. When using your phone out in the sun, you might realize that it kind of turns into a furnace when the sun is just really baking that thing. So I'm really hoping that under the skin, somehow it could still be temperature regulated, but we'll have to see what they do. And of course, the FDA is really making sure that there's biocompatibility here and that the body will actually accept this implant instead of trying to fight it off as a foreign body. So they want to see that the immune response to this implant be as minimal as possible. Another thing that somebody asked is about about the actual bandwidth of the device, so how much processing can it do or how much data can it handle at one time. And for the thing I was talking about earlier where the speech signaling could mean very fast, large amounts of data going through Neuralink, it would have to actually be able to process all of that information with speed and with efficiency. So they're working on ways to address that so that it can handle more and more data. The only issue comes with the actual implant being only the size of a quarter. They're saying that it's hard to not run out of room, so they need to be able to shrink that technology down as much as possible. As always, let me know what you thought with a like or a comment if you haven't already, and I'll see you in the next video.